Chaos. I am a disability policy consultant and contractor with CFILC's California Disaster Coalition, and your host today. So I'm in my office. So I'm June Chaos. I'm in my office. I blurred it out. I blurred the background out because, frankly, I just didn't have time to clean it up today. But you're seeing me. I have gray and brown hair. I have a blue casual shirt on with a blue striped collar and a little polar tag vest and glasses. And that's me. You can't see any background because I just didn't have time to clean it up. So I'm going to ask Karina for a little bit of an accessibility briefing. So over to you, Karina.
Hello, everyone. This is Karina Pullen, a program coordinator for CFILC. I'm going to be the tech host for this particular meeting. A couple of things. We do have a real-time captioner. So we're making sure that that all works. There should be, we're in the process right now of transferring it from the automatic to the regular real time. So that will be provided. In the meantime, I'm just going to do the auto transcription until the captioner says we're all good. There will also be a stream text link in the chat that I'm going to put in right now. So you can reach that, or you can go down to the toolbar at the bottom of your screen where it says CC. And that's going to be live transcripts on your Zoom as we go. Please give me a message in your chat if you need any other access needs or have any questions, and we will do our best to accommodate.
Okay, thank you, Karina. So the street text is, the link is in chat, and just being clear, is it good to go?
Yeah. I believe so.
Okay, Jim House, give me the heads up in chat when you've got good access. Captioner is ready. Good. All right. Well, thank you for bearing with us. We have a new way of registering starting today, as you all experienced. Hope it wasn't too painful. And we've done the new way to avoid any kind of unexpected Zoom bombing experience. So this hostel lets us know ahead of time who signed up for the call and who our audience is. So just a preview of calls that are coming up on the second Tuesday of the month in April, because this is a two-part topic we're doing today and next month. But in April, we have a conversation with Vance Taylor, the chief of the Office of Access and Functional Needs here in California, the governor's office of emergency services. In May, we have a conversation with the partnership, which is the only disability-led organization which focuses on equity for people with disabilities throughout our planning program and service before, during, and after emergencies. We also have in June with World Institute on Disability talking about their emergency disaster and climate resilience projects with Dawn Skaggs. And in July, we have CFILC's Lisa Austin talking about really all about batteries. What do we know in terms of life-saving, supporting, and sustaining devices? What's working? What's in the future? Where are we with batteries? And in August, we have Andy Imparato, the executive director of Disability Rights California, and he'll talk about his work on the presidential COVID-19 Health Equity Task Force and the published report and the subsequent next steps in monitoring and advocacy directions that we should consider and need to know about. So, Russell, can you speak for a moment regarding your up and coming call?
Absolutely. Thank you, June. Hello, everyone. My name is Russell Rawlings. I am the statewide community organizer at California Foundation for Independent Living Centers. And on the fourth Thursday of the month at this same time, 10:30 to noon, we have the California Disaster Strategies Coalition organizing and networking sessions. And these are an opportunity for us to come together and strategically talk about what is up and coming in terms of where we can push policy. So together, after these topic calls, often many things get brought up, and we can kind of use this as a space identification, but the fourth Thursday is a good chance to come together and strategically shift policy. So please join us on Thursday. Thanks.
Thank you, Russell. And you could also use chat. I've noticed a new convention happening in the last several calls I've been on. I kind of like it. If you want to introduce yourself in chat, that's good. Like Greg, I'll pick on you. Like Greg Thompson, and maybe who you are, what's your position. That helps us know who's on call. So if you want to, feel free to introduce yourself in chat. So heads up, we'll do a poll at the end of this call just to get your feedback. We learn a lot from you about what we did well and what we need to work on. So please do the poll with us at the end. And Karina will also post in chat a way to provide feedback via SurveyMonkey link if you have to drop off early. So today is part one of a two-part series on building strong relationships with local government emergency management departments. And we have Eli, I'm going to butcher your last name, Eli, so you'll correct me, Gillardin, Chief Executive Officer. Go ahead, what?
I said, great job.
Oh, thank you. The Marin Center for Independent Living. And our other panelist, Heather Santos, had a last minute emergency. So we're going to not hear from her today, but maybe we could get her on next time. And Carly from Executive Director and Freed is on today, although she is not speaking today, but she may indeed pinch hit a little bit. So Carly, feel free to pop in. So what we've asked people to talk about today, Eli, is describe for us the geographic area that his center serves, the culture, the population, and then in terms of emergency management, local relationships, what are your successes? What does it take in terms of your time and effort? What's your history? What's the relationship building been like? And do these relationships go beyond local government emergency departments? And if yes, what are the other emergency related relationships in other government departments that are part of your experience? So basically, what works and why, what needs work and why, what solutions are in the making, what lessons can you share that the rest of us should apply, advice? How much time does this all take? What's the return on the investment of time? And the $1 million question, if you left your center, would this continue? And if yes, how? And what are your meaningful measures? How do you measure impact and success? So nothing much, just a few simple questions here. So have fun with this. And Eli, I'm going to turn it over to you.
Thank you, June. Great to see everyone. Easy questions, really easy questions. Again, Eli Gelarden, pronouns he, him. I'm a middle-aged little person, Caucasian, graying hair, bushy eyebrows, and I'm wearing a, I guess you can't see it, maybe I'll lower it, wearing a button-up plaid shirt, which is part of my daily uniform. Marin Center for Independent Living, just for context, we're a almost 43-year-old community-based nonprofit independent living center. Like all the centers in California and around the country, we really came out of the disability rights movement of the 60s and 70s, really centering on choice, independence, equity, and the right to live safely and inclusively in the community. As a center, one of the, I'd say, early-ish independent living centers, we've been very fortunate to kind of build relationships over time, trusted relationships at all levels in our community. So Marin County, just for context, we are the other side of the Golden Gate Bridge, often referenced. So we serve a fairly diverse geographic area. We have forests and national parks, seashores. We have urban areas. We're kind of in between wine country and coastal communities. And really, when it comes to disaster response and emergency response of all kinds, as we've seen with climate change across California, our community, which in Marin County, we serve the most aging population in the state, is increasingly impacted on all levels by the impacts of climate change. And most critically, our access and functional needs population, which is growing every year. Over a third of our population will be 60 plus in the next 7 or so years. And when you include the aging population, the disability population, and the kind of intersection of aging with and into disability, that continues to be a significant demographic in our community. But what is clear is that our AFN community has been most severely impacted on all levels of disaster. So, kind of going back to your questions, June, around building relationships with local governments. As I mentioned, being one of the earlier independent living centers, it really was important for us to connect deeply in the community and evolve as our community has evolved. So we build trusted relationships with our local electeds. We have always been a resource to consult and advise around issues of access, inclusivity. We were very involved in the creation of the Disability Access Manager position in the County of Marin, and are working closely right now with our county in kind of implementing at a local level elements of the Master Plan on Aging, which of course we call the Master Plan on Aging and Disability, being a resource and a trusted partner with our local area on aging around the Aging and Disability Resource Connection, we're formally designated, contracting with our local federally qualified health center, and really addressing the needs of our most medically complex and obviously disabled population of community clinic patients. So I give all these examples really to say that it's not even just about emergency preparedness, it's about being a trusted resource and being at the table for all conversations that impact the community and the population that we serve. So kind of taking a step back from that and talking a little bit about our disaster preparedness work. I'm going to pop up a little PowerPoint, and I also have a video which I will share a link to in the chat for later. So bear with me while I host disabled participant share. Can I enable share screen? Let me know who can do that for me.
Karina, can you do that, please?
Brenda, this is Megan. I think if you make Eli a co-host, he'll be able to.
All right, great. So let me. Almost there. Okay. Do you see the first slide, Powered and Prepared, Marin Center for Independent Living?
Yes, we see it.
Okay. So in partnership with California Foundation for Independent Living Centers, the Disability Disaster Access and Resources Coalition, we launched what we call Powered and Prepared in Marin last year, really formalizing the pilot work that we did with CFLC and PG&E around providing emergency resources and planning for people with disabilities and older adults living in Marin. We felt it was really important to brand and invest in the programmatic design. And this does really go back to building relationships, ensuring that our community, our electeds, our partners in county services understand exactly what we're doing. And what we're doing at the highest level for Marin CIL is establishing a climate resiliency program. And central to our climate resiliency efforts, kind of going back to whether it's wildfire, whether it's sea level rise, whether it's severe weather and winter storms, our AFN community is the most impacted, and Marin Center for Independent Living, our responsibility is to ensure that our community support is aware of that, and that we invest and support in our AFN community and their safety and independence during climate change. So I'm going to scroll down. So I know we have a lot of independent living folks on the call. What we, and this is a presentation we kind of give to the public, so there'll be some repetition for folks. But, we bucket our services in kind of a few areas. This concept of housing retention and navigation, providing home modifications, and landlord-tenant advocacy and facilitation. Facilitating care and accessing care through transition care management, ensuring that decision-making support and coordination of services for individuals returning to community after a hospitalization or living in a skilled nursing facility are really done effectively and with a person-centered lens. We have for many years provided a personal care or personal assistant registry, ensuring that in-home assessments, visits, caregiver matching, as well as assistive technology and peer mentoring are provided. We do a lot of support around benefits navigation. And of course, always advocacy, independent living skills training is central to what we do. We really, again, center this on people with access and functional needs, recognizing that while, that's typically identified as older adults and people with disability, it also includes our immigrant population, individuals with limited English proficiency, and others with, complex and chronic conditions or injuries who might not necessarily identify as disabled. And recognizing that specifically for Powered and Prepared, we want to address the gaps around how impacted people with access and functional needs who rely on medical equipment are when there's a power shutoff. We want to build the supports and resources, not just what we offer within our program, but the county resources that are available during disasters to people with access and functional needs. And we want to work with local partners, and I'll go into that a little bit more later in the slide, to ensure that, we as a community are partnering kind of within the one door framework. We're all hubs, we're all spokes on the wheel, connecting our AFN or AGN disabled community members with all the resources they need so that we're ensuring safety and ultimately saving lives. So as I mentioned, we do this in partnership. So you'll recognize, obviously, Disability Disaster Access and Resources. Thank you for hosting this call, and CFILC, but also our local partners, Fire Safe Marin, which is part of the local fire wise communities, and as well as they facilitate a LISTOS grant. They have really been tasked with doing neighbor to neighbor preparedness. And the video that I'll share later really is a product of our work together, educating the neighborhood groups in Marin on how to support people, their neighbors, their family members with disabilities during emergencies, including wildfires and public safety power shutoffs. And we're actually doing some upcoming events, which we'll also talk about a little bit later in the discussion. One of the opportunities, I'm really proud of the work that we have done in Powered and Prepared in identifying residents in Tier 2 and Tier 3 service areas, and those are the highest risk fire threat. That's what this program centers on. Tier 3 being extreme risk of wildfire, Tier 2 being elevated risk. But we also have a lot of folks in Tier 1 where they do not necessarily have access to all of the services available through Powered and Prepared because of their geographic region. Maybe they live in the urban area in San Rafael here. Maybe they live in Marin City, in Southern Marin. But as we've seen, everyone has been impacted with, rolling blackouts, winter storms, regardless of what tier you're in. So while we've done a very good job within the confines of the program, I'm also really interested in expanding our work through other grant making and foundation support, so we can really address the folks in tier 1 who might need some of the services that we'll be talking about in a minute. And those services really center on these buckets. One, that in the event of a disaster and wildfire or power shutoff, Marin CIL and our entire team will work closely with the Office of Emergency Services, the Sheriff's Office, the County Health and Human Services, and our work through the One Door, the Aging and Disability Resource Connection, in identifying and facilitating resources for folks impacted by wildfire or power shutoffs. Back 2 years ago, during the Woodward fire in West Marin, the county actually reached out to us because they knew, we had this pilot program. It wasn't powered and prepared just yet, but they knew we had a access to our consumers who we enrolled in what is now powered and prepared, and they wanted to know who needed to be evacuated. So we worked closely with county emergency services in identifying potentially 30 individuals in the service area or in the West Marin area that was being evacuated. We reached out to them, we called them, we made connections, and of those we found 3 individuals who actually needed pre-evacuation support. They didn't live exactly in the kind of perimeter of evacuation, but because of the severity of the smoke and the growth of the fire, it was likely that they would eventually need to be formally evacuated. We wanted to make sure that they were evacuated safely. And so using the powered and prepared resources, we found them temporary housing. We coordinated with local transportation, our local paratransit provider. We provided food stipends, and we secured, I think they were averaging 4 or 5 day stays at a local hotel outside of the evacuation and pre-evacuation area. Again, those relationships, that work really started years ago with, frankly, leadership and advocacy, and recognizing that in order to play a role, any role in disasters, we had to be a trusted partner. We had to be a reliable partner that the county, that the Office of Emergency Services, that the Board of Supervisors knew they could rely upon. And we've demonstrated that with our service work. We've demonstrated that with our communication. We've demonstrated that with our guidance. So when the actual disaster happened, I got a text message from the Office of Emergency Services, from the AFN lead in OES, and it was that direct communication that accelerated things. So kind of stepping back to the services, obviously building personal preparedness planning and registering for emergency resources. Everything that we've developed has an online portal, marincil.org/prepare. And that includes signing up people for the medical baseline. Of course, getting, I talked about the transportation, food, and powered and prepared resources, and everyone wants the high voltage batteries, and obviously that is central to our work. But I think kind of the picture I'm trying to paint is really the high voltage batteries are one resource. It is really that connection and that collaboration that you're doing with local partner organizations, whether it's the county whether it's other key CBOs doing community response work, how do you build those relationships? So this next slide kind of walks through how to get more information on Powered and Prepared and applying online. I'm just going to kind of breeze through it. Really, wanting to ensure that our consumers should create, and clients and community members and neighbors should create their own plans and building their networks of support. And, again, kind of working with those community groups, those Firewise communities, in kind of creating greater awareness for the need to support people with access and functional needs, really the need to center and prioritize people with AFN during disasters. And so giving them, recognizing mobility needs, personal disaster kits, other supplies, food, water, durable medical equipment, devices, adaptive feeding devices, and any equipment that relies on power. I've talked a little bit about the portable batteries. One of the kind of advocacy, education, awareness components, a lot of folks, and this is where I go to the medical needs, don't identify as people with disabilities, but there are so many individuals across the state, in our world really, who are reliant on CPAP machines, for example, or some form of oxygen and pulmonary support at night. It's really important to help community members and neighbors identify themselves or their friends and family as needing, high voltage batteries, and recognizing that they do rely on some form of durable medical equipment and could qualify for Powered and Prepared. We have done an incredible amount of outreach and connectivity with other community-based organizations, not just county leadership and Office of Emergency Services leadership. We actually, through our grant, partnered with, and I want to see if I included it in here. Now, we've subcontracted with 8 key community-based organizations within our community, serving a variety of different levels of folks with access and functional needs, immigrants' rights groups, CBOs that target individuals with intellectual disabilities, are monolingual, not just Spanish, but Vietnamese and Tagalog communities, and particularly in Marin, where we have, it is a wealthy and well-resourced county, but there are pockets of severe poverty and disparity between, equity, I guess I would say, of our most resourced and our most under-resourced community members. So it's really important that we build those relationships and actually put money and contracts behind it with other key CBOs and had them help us with the outreach and engagement to the community. Obviously, in terms of access, making sure that our program was available in all formats, not just digital, but that we have a presence on social media, doing a ton of newsletters and email communications, and connecting to folks on whatever format of access they're comfortable with, recognizing that a lot of our community is still outside the digital divide. And just, finally within this presentation, really helping educate our community partners that people with disabilities have civil rights and protections during disasters. It's a civil right. We have a right to disaster alerts and information in a format that is accessible, a right to be included in community evacuation transportation plans, a right to disability services and supports in an accessible community shelter, a right to barrier-free shelter and temporary housing, a right to keep our service animals throughout evacuation and sheltering, and that these rights are protected through FEMA and other, federal agencies, and ensuring that the community knows that this is, it's not just the right thing and thing that we need to do. It's legally we have an obligation. I know I was a little bit over the map, June, and I'm sure I only answered like 3 or maybe even 2 of those questions. So happy to do a lot more kind of conversational back and forth. Again, if you want to see our program online, you can check out marineseattle.org/prepare. We are continuing to learn and evolve and build this program. Our community is not large. The County of Marin is only about 250,000. I believe, and I'll have to check my stats, but I believe we've served over 350 individuals with access and functional needs since the launch of Powered and Prepared. That's a lot of work, but there's still so much more work to be done. Also kind of moving forward, what I'm really interested in doing is actually developing a full-time kind of AFN position in Marin CIL. Right now, this has really been done through a team approach, which is great, but kind of recognizing where we are in COVID, in climate change, having a climate resiliency navigator is kind of the next level up that I would like to pursue locally. And so kind of, again, using Powered and Prepared and disaster access and resources as a foundation for our climate resiliency work. That's where we're heading. Again, continuing to build relationships, putting out cool videos and material that folks can access. Also doing town halls. We have a town hall planned in April to actually an entire town who asked us to present and reach out to all, I think like 900 of their homes and invite them to talk about our work. I'm
So,
sure there
Eli,
I'm gonna pause there
Yeah.
and stop my share screen. And yeah, happy to take it in any direction from here.
Thank you. I'm going to just remind the group who probably has a lot of questions, just you can use the raise hand function in reactions, or you can type your question in chat, or yeah, those 2 areas, or you could just pipe in with your questions. Yeah, we like to keep it going. So questions, not comments, just, question-based discussion would be great. And Eli, any of those videos you mentioned that you could share the link to in chat, that would be great. And also how we get to look at the PowerPoint slide deck. At some point, we like to share that with listeners as well. So to create a link to that, that would be appreciated as well. So thank you for a very thorough overview, and over to the group for questions, comments.
It looks like Lisa has a hand raised.
Go ahead, Lisa.
mute myself. What is being done to expand Powered and Prepared beyond Marin?
Well, we're just one contractor within CFLC's Disability Disaster Access and Resources program. So I know each community is doing their own kind of launch and facilitation of DDAR. I can't speak for how that looks in every community. I know Carly and others will be talking about their work locally. I would say that, we're all learning, and informing and trying to build better. We recognize this is just one, I recognize this is just the start of what has been a systemic and ongoing gap for people with access and functional needs. But sometimes you just got to roll up your sleeves and put a foot forward and do the work. And it's not going to be perfect. It's going to be messy. It needs to be better. So again, kind of going back to the Marin approach, this is where we are. We're proud of what we've done so far. We know a lot more work needs to be done. We really want to ensure that folks in that tier 1 fire threat area have access to all of the resources as well. And we're looking to, again, look at other granting, making other funding, integrating other support networks to build this up.
Thank you.
And the video link is in the chat, as well as our website. And I'm going to give you another link which will connect you with some of the disaster kit training resources we put together, as well as the PowerPoint. I just have to find that. So give me one moment for that, but happy to answer other questions and conversation, Joe.
Eli, while we wait for some more questions in chat, how did the access and functional needs position come to be in Marin government, and how old is that position?
That's a really good question. I would say it's really only been in the last 2 years. 3 years with the North Bay fires in Santa Rosa. Marin was an evacuation site. We hosted many of the evacuees from Santa Rosa. And I think it was a combination of the advocacy happening in Sacramento, the great work that, you and Vance and Christina and others have been doing at the state level of OES. And then our county recognizing and Marin CIL communicating locally and being at the table for that disaster response work in the North Bay fires several years back, and having an awareness that OES needed an AFN lead. And so I mentioned the disability access manager position in the county that started 15 or 20 years ago. That individual is also the AFN lead in the Office of Emergency Services. Marin CIL is invited, well, we don't have a formal seat in OES as an AFN lead. We are invited into those conversations frequently. During COVID, we actually developed an AFN task force. The county developed an AFN task force, essentially county staff, Marin CIL staff, staff from the regional center, to kind of triage and navigate all of the emerging issues that were coming up during COVID, whether it was, vaccine rollout, kind of education and training around vaccine hesitancy, accessibility around getting vaccinations. So, going back to your question, I think we've always had the disability community has always had some presence, but really more in the last 4 years has that AFN position been formalized. And we are fortunate again that our county understands that, access, particularly in emergencies, is essential, and they hold a responsibility.
Thanks, Eli.
June, this is Sherry. I was wondering if I could chime in.
Sure thing.
Okay. So thank you, Eli, for the great presentation on what Marin has been doing in your area. And I will be presenting along with Carly next month on similar questions about what we're doing in our communities as well. I have a question for Eli, but first I want to respond also to piggyback on Eli's response to Lisa with regards to the DDAR coalition under CFILC and working collaboratively with PG&E, is that it's not a perfect system. It's still kind of undergoing every year evaluation and new iterations and hopefully improvements. But the good thing about the project is it does cover most of the state, at least where PG&E provides utility services. So each of the independent living centers and others that are participating in the project that are addressing primarily public safety power shutoffs, but also expanding a little bit beyond that, is that we do have a collaborative effort, so that even with us providing the education with the consumers and the training and helping them build their disaster readiness plans, making them aware of the resources that are available, seeing if they are in those tier areas where they have experienced in the past or may experience in the future, PSPS events, they're in fire hazard areas, that they will have support through hotel stays that we can set up for them. We can provide caregiver services at those hotel stays. We can provide them with food, transportation to get there and back home. And if they can benefit from one of those portable power stations that Eli showed you, is that we will set them up with those, and we take them out to their homes, teach them how to use them, how to hook them up properly, how to store them, how to recharge them, and check in on them regularly. So there's wonderful benefits for folks that with AFN needs with this particular project. But it's true, it doesn't cover every county in California. So we do need to figure out a way to do that and to provide additional resources as well. Some of the things that we'd like to do, our hands are a little bit tied because of the CPUC not making rulings that we would like them to do as far as the expansion beyond PSPS kinds of situations. We all know that there are other power shutoffs that don't fall into that category that affect people just the same way. So, there are improvements we would like to make along the way, but we can collaborate, and we do with each other. So if Eli needs some extra batteries in his area and I've got some extra ones, we will get those to him, and vice versa. So that's a good thing about that particular project. But what I wanted to ask Eli about was that there's a lot of the collaborations that you've set up over the years with your emergency managers, with public health and entities that are responding to disasters that were essential during the pandemic in the last couple of years. And I was wondering if you can share about how important those relationships were and what evolved as far as the services you were able to offer the AFN community in Marin because of that.
Yeah, thank you, Sherry. Great question. Like Powered and Prepared, being at the table, being a advisor and a resource for the county. And not me, but our entire team has been essential and helped us continue to build out our offerings. So, you know, I mentioned our work around vaccine distribution. That kind of led to the reality that, you know, digital access, digital equity, as we call it, is such a significant gap. So much of, you know, getting the registered for a vaccine was happening online. We worked in partnership with our county to create a access call center, kind of standing up a call center for folks with access and functional needs who needed support, you know, not just connected to the state website to sign up for a vaccine, but walked through the process of registering. And that kind of morphed from Marin CIL into the launch of our Digital Access for All program, which is also on the website, providing Chromebooks, utilizing ability tools and the digital access resources, and also doing digital literacy training and partnering with a local organization to implement that. That's just one example. Our caregiver equity work, one of the other big takeaways, you know, in our early, you know, partnerships with public health and health and human services during the pandemic, our caregivers were being called upon in very intense and COVID positive situations. And it raised the flag for us, which, you know, I know many of us are talking about, kind of centering our work more intentionally on the direct care workforce, the under-resourced, underpaid, and in many cases not well protected from COVID during the pandemic. So we've been working very closely with our public authority, with Health and Human Services and IHSS, as well as our local county health improvement plan and the hospitals to prioritize caregiver equity, whether that's a living wage, whether that's creating a caregiver pipeline with our local community college, whether that's offering self-test kits. I know many of us independent living centers have been fortunate to access rapid antigen tests. And we've been working closely with all of those partners to get those out to both clients and caregivers. Those are two examples, but you know, there are many others. I guess I would just say for all of us as independent living centers, peer-led organizations, we have such an opportunity to share our lived experience with other community leaders. First of all, we are community leaders. We have an opportunity to share our lived experience with other community leaders and electeds, and let them know how best to serve our community. And I feel like I'm very proud of what we've done in Marin on that. And, you know, I think many of our other centers are doing that same work. And yet there's so much more to be done as this pandemic goes on. But, you know, whether it's, you know, disaster response, digital equity, you know, housing support and preservation, you know, all of this work is so essential to keeping our population, our community safe and independent during COVID.
Hey, Ela, June, here's a key question in chat from Catherine. If someone is in a county served by PG&E that has a participating CIL, but their city has its own utility, how do they get support? I'm thinking of the city of Santa Clara in Santa Clara County. They have Silicon Valley Power. And I will add to that question, in LA, the utility is the Department of Water and Power, a city-run utility, not an investor-owned utility. So sometimes some of us feel a bit left out of the programs you all operate under investor-owned utility, that map.
Yeah, I mean, that's a great question. I can't speak for other communities because in Marin, it's PG&E and Marin Clean Energy, MCE, and we are working with both of them. But maybe one of my other colleagues that has city, its own utilities companies can address that.
Yeah, thanks, Eli and June. I actually had just responded to Catherine right when you were reading her question. In the case of Santa Clara City, yes, they have their own electricity utility services, but they also still utilize PG&E for gas. So the residents still have to use PG&E for their gas services. All they have to do is have a PG&E bill. So even if they're utilizing the Santa Clara City services, they will be eligible for the DDAR services under our contract. That's not a problem. I can't speak for folks down in Southern California who are under Southern California Edison. They have their own program down there. Maybe Eli or Carly know a little bit more about that, but the program that we're running is a collaborative effort specifically with PG&E, but Santa Clara City residents still qualify.
And I can take a little bit of a angle on that. This is Carly Pacheco. I'm the executive director of Freed. So we also have a DDAR program covering multiple counties. Nevada County in particular, which I'm going to talk about more specifically next month, is really an interesting county. We're divided by mountain range, and the eastern half of our county, which is right on the Nevada border, is actually fed through Nevada state utilities. And it's a really complex system. I think there's 3 different utility agencies that are involved depending on which area geographically you're in Truckee. And I would just say, continued advocacy. I think we've proven the effectiveness in a lot of ways. Obviously, as my colleagues have said, this is still a work in progress. But so much has been proven through this program. The county of Nevada is working really hard to advocate for their citizens that are fed through those other utilities. And we're partnering with them to do that. And we can prove the number of people that are affected and how significantly they're affected. We have some good evidence for that now. In Nevada County in particular, the county has contracted with us to be able to provide essentially similar services to those residents that are in Truckee. That is not our long-term plan because we want those utilities to step up to the plate. But in the meantime, the county has put forth some funding so that we can serve those residents in a similar manner. So again, I think it's continued conversation and advocacy and really talking about the impact of the program that we can all do.
Yeah, one of the themes that you're hearing from Sherry, Carly, and I just getting to the table, building the relationship. It's to June, your question in the chat on, providing advice and beginning steps to those who are struggling to establish emergency-focused relationships with their local government. We don't have to be experts at disasters. We're expert on disability rights. We're experts on disability justice. We're experts on lived experience. We know what our community needs. And that is such an important and valuable, incalculably valuable resource for our electeds, for our first responders. They don't have that. And we are subject matter experts. And so just having those conversations, talking, and I know it's hard with COVID and, Zoom conference after Zoom conference, but having those one-on-one conversations with your folks, your, Office of Emergency Services or your local, Health and Human Service departments, ask them. Maybe a starting conversation is just, what have they seen over the last few years in terms of increasing need for support, and what are they doing and what are they struggling with when it comes to, how to support people with disabilities, older adults, people with access and functional needs, and just kind of taking a approach of, inquisitiveness, curiosity, and being a resource, and then building the relationship, the trust, and doing the work over time. It's the long game, and it's very frustrating and dispiriting when we see examples throughout the state of folks with access and functional needs being left behind. But the work, isn't going to go away. Climate change isn't going to go away. So wherever you are locally, just build on top of that with honest conversations. Participate in Board of Supervisor meetings. Bring items up in public comment. Both kind of public setting, but also those one-on-one conversations outside of the public venue. That would be one suggestion. The other, and I'm speaking for my organization, but I think it's a theme across the state. Do as much public education, town halls, collaborations with other community partners, with neighborhood groups. Get the community aware of your program. Get the community aware of how to identify and support folks with access and functional needs, whether it's with DDAR, Powered and Prepared, or just at a fundamental level, creating like more awareness on neighbors helping neighbors. It's so important. We all are impacted. Family members. Everyone has a family member who's an older adult or a person with a disability, and it's just creating that situational awareness, and kind of repeating and doing that over and over again. And now I'm rambling. I'm going to stop rambling.
Can I jump in just quickly, Eli? This is Carly again with Freed. That is top of mind for us. Nevada County and other counties that we serve just got hit with really massive winter storms and massive, very long-term power outages. And I'll talk about that more next month when I present. But what the focus really, I think, needs to be on the unexpected. All of our systems, and we had some really great plans and great systems, and they all crumbled under this recent event. And where we saw a lot of success was neighbors coming together, and people, communities coming together. And I think the more we can focus on that and focus, we talk in Nevada County and at Freed about find your five, right? 5 trusted allies that you can be communicating with and have plans with in the event of an emergency, some close to you, some far away. Those are really critical things that people are going to need. We're going to continue to see unprecedented events. That is the term that we're getting so used to, is unprecedented. And so I put a link in the chat. We do a monthly radio show, and we focused last week, our show focused on this most recent winter storm. And we had a community member who is a consumer of ours and someone who utilized our resources during this most recent event on the show to talk about her experience. But she really focused on how social networks in her neighborhood and even social networks among evacuated consumers during this event really bolstered what resources were available to people. I just thought she had some really great insight to share. So it's a half-hour show. I put a link in the chat, so feel free to check that out as well.
Thank you for the point.
That sounds great, Carly. That's a good radio show. I've listened to it. It's good work.
I think you've been on it too, June. Am I wrong?
Yeah, yes. I had a question for all of you, Sherry, Carly, Eli, and others. You know, many of you, your California CILs benefit from the PSPS, Public Safety Power Shutoff funds to support your emergency efforts. What happens when that money goes away? What happens to your emergency focused efforts?
I'll go ahead and start, June. This is Sherry. I'm at Silicon Valley Independent Living Center and have been for the last 6 years, but I also started my IL journey in life at SVILC decades ago. So it was the first center that I worked at, and that was in the mid 80s, and I was there until the mid 2000s before I went over to Krill, serving Southern and Eastern Alameda County. I was there for 9 years. And both while I was at SVILC the first time, as well as at Krill, we did not have any PSPS funding from PG&E, but we were providing disaster, AFN-focused disaster training to consumers. And we were involved in community relationships in the VOADs, the Voluntary Organizations Active in Disaster, from day one. So I went after small grants at that time to buy things like emergency kits for our consumers. So when we're doing our regular workshops and training with individuals with disabilities and their family members or caregivers, is that not only do they get the information, the training of how to build their own disaster plan and create those connections with friends, families, neighbors for emergency assistance, but also they got started with a disaster kit, because that often is a barrier right from the get-go of the expense of having to buy one. So we would give them a kit. And I went after various sources of funding in order to do that. And that was well before PG&E. Also during the relationship building of participating in the Voluntary Organizations Active in Disaster, is that we became known to the emergency managers and to the public health folks. So all of a sudden then other opportunities opened up for additional grants. We were able to get funding when I was at Krill through Public Health Department to provide community-wide training. It was held at City Hall. And so that we'd have hundreds of people from the surrounding area, city, Hayward, Fremont, San Leandro, come to this event every year. And it was a disaster awareness. And we focused on the AFN community as well. So it was well attended. People got information, got educated, relationships continued to be built. Neighborhood emergency response teams. People learned about how to develop those and get involved in those. So I have no concern at SVLC at this point if in fact that money dried up tomorrow and we didn't have that, is that we would maintain this program and these services. They are embedded in what we do. They are part of independent living skills. And that's a core service that all independent living centers provide. So they are part of who we are and what we do. And part of our mission is to, again, as Eli said, is to build independence and resilience among people with disabilities to help them achieve their goals and dreams of being able to be as independent as they'd like to and live where they want to in the community. And part of that is being able to take care of their own needs and also to build those relationships and know how to do that in order for them to be safe and thrive during any kind of emergency situation. So we will continue the services regardless.
100, this is Eli, 100% what Sherry said. And we have to operate proactively, not reactively. Like, let's not worry about funding going away. We have to build funding capacity. You know, I always go to Wade Gretzky's quote, I don't look at where the puck is, I look at where it's going. Climate change is not going away. Climate change is increasing. You know, the impact on the AFN community is only going to increase. The aging population, the population of older adults and people with disabilities in California is only going to increase. So it's our job to educate the funders and say, this is the reality. This is where we're at. And it's not just, in my opinion, it's not just the responsibility of one funder and one grant. It's the responsibility of the entire community, of the entire philanthropic community to prioritize AFN, to prioritize resiliency of our AFN community. And, you know, we need to seek out those other opportunities, whether it's locally or statewide. And, you know, if they're not there, we create them. We advocate just as we always have, you know, for the 40 plus years that independent living and disability rights has been around.
Well said, you both, all of you. Here's a question from Catherine Spear. How do we influence local regional centers to do more? I had to make a California Public Records request in order to try and get data. They would allow me to have the data, numbers, disability categories, ages, people in my area that would allow me to do local city government, county emergency personnel to show how important it was to include people with disabilities in emergency planning and appropriate resources. I never got what I really needed.
That's a great question. You know, and every regional center obviously is unique. Every community is unique. One suggestion would be to start with the State Council on Developmental Disabilities. And, you know, each region has a representative for their area on the State Council. And, you know, figure out who to connect with through the State Council locally to identify who to talk to around emergency preparedness. You know, we also, former employee of Marin CIL, Peter Mendoza now works for the State Council on Disabilities. Also a phenomenal advocate around disaster preparedness. And I'm sure that, you know, the combination of SCDD and Peter can point you in the right direction locally.
I would, Eli, as Junior, like Dad, you know, there's a lot of numbers available in terms of people with disabilities in our community, whether it's census data or some of the National Health Information Survey data per county. There's a lot of ways to look at the numbers, but to get that regional center focused, you know, it's again relationship building and how open they are to this important piece. Like Sherry said, part of all of this is recognizing that a person's independence is about their health and their safety and their resilience for the long run, for the long haul. And it should be embedded in what we do. And certainly that includes regional centers. I know that some are much more engaged than others in emergency work. So it takes that nagging and nudging and relationship building.
Yeah, June, this is Sherry. You already, you answered the second part of that question as far as getting data. And there are places to get data where it is collected. I think it is always frustrating for us that often people with disabilities are left off the data collection. It was a point of contention for many of us advocates, and that during the vaccine distribution and collecting data at the local level, that the state was not requiring the local communities to find out what if people had disabilities when they were getting vaccinated. So, a lot of times public health actually would ask me the question, can you tell me how many people who are not getting access to vaccine, because I was advocating for us to do in-home vaccinations, mobile units. And I'm like, well, you're not helping actually me answer that question because you're not asking that question. So I can tell you in our county how many people would be possibly affected by not being able to get to a vaccine site, but I can't tell you how many people are left for you to be able to reach because of the lack of collection of data. So there is data out there, but it is hard to find sometimes, and sometimes it's not answering all the questions that you need. So again, always a point of advocacy for all of us to make sure we're collecting the information and our government is collecting the information. With regards to the regional center, yeah, it is again about relationship building and making sure that they're at the table, and that comes sometimes with an invitation. My organization was not working, all that in much partnership with our local regional center, other than occasional referral back and forth. And sometimes we were providing direct services to some of the consumers at the regional center, but we didn't have a collaboration per se on any particular project until we got involved in disaster readiness strategies, and through our VOAD, again, that was the way that we got the regional center involved. And now actually I have a colleague over at the San Andreas Regional Center who is my co-lead for the AFN task force. So, we are the go-to for our local VOHAD for AFN needs. So I know I've got a person that at the regional center that is my partner as far as that goes. And that, again, takes time. It's just, again, relationship building and making sure that you're at the table, and then looking around you and seeing who's missing and inviting them.
Well, before we wrap up today, any other questions? Well, as Corinna gets the poll up, I just wanted to thank you all. It's an excellent discussion in terms of peeling the onion back on complex issues and network building, and making sure that, as Eli said, I like that this is the long game of sustaining and embedding and relationship building and funding. There's a lot of network building, a lot of different pathways that can be followed. So thanks for giving us a lot to think about. And this is only part one. So part two, stay tuned next month, where Carly and Sherry, who you met today, will do a deeper dive in their areas of California, and we will continue to discuss the issue. So I urge you to do the poll, and I don't see any other questions. So thank you all. Appreciate the discussion, and all the links in chat. We'll get that posted when Cameron puts the segment on YouTube. We'll get you a link up there where you can find the chat as well with all of its resources. So thank you, and appreciate all of you. Talk to you next month.
Take care, everyone. Have a great day.
Thank you.
Thanks, Eli.
Thank you.
Thanks, Eli. That was great. I knew you'd carry it. I don't know what happened for Heather. I hope she's okay.
Yeah, no.